Welcome, my dear friends. Myself, Professor Dr. Rajendra Raghuvir Deshpande from Pune, Maharashtra State, India, would like to welcome you all in the class. This is the class, and in the class, we are taking the lecture and discussion. So, this class is regarding the Kaumarbhritya tantra, the subject of the third year BMS, that is Ayurvedic pediatrics. Bala Roga Vijnana. Bala means the child. From the birth up to the age of 16, Ayurveda considered as a Bala. But of course, there are a lot of stages. For example, in the first 2 years, you may be remembering there are 3 stages: Kshirad, Kshiranad, then Annad. Kshirad means only breast milk up to the 6th month. Then from 6th month to the 2 years, Kshiranad, Kshira milk plus food. And then after that, Annad. That is mainly the external adult food and of course with the milk. So Kshirad, Kshiranad and Annad. Today we are going to discuss the topic growth and development of that fetus or the baby inside the uterus. So we will try to define the different things and how it is going on. I am sorry, we are discussing not the in the pregnancy, but we are discussing after the baby. Just a moment. Month-wise development of the fetus. Yes, we are not discussing about child. We are discussing about the fetus. I am very sorry. So please write down the topic, that is growth and development of the fetus. That is, of course, we are discussing in the intrauterine life. Please write down intrauterine life, that is in the uterus. Of course, I am going to tell you after the birth also. I am going to tell you, but this is the topic is mainly concerned with the intrauterine development of fetus. According to the, like here you can see first month, second month, third month, fourth month, fifth month, sixth month, seventh, eighth, and ninth, and 10th. This is the total this type of the development. Okay, so we will learn month wise, step by step, just marking the portion as usual. And after the time this particular page is finished, then I will discuss you something more, or I will also make some revision about the development of the fetus as well as the baby, the newborn baby. Okay, so write down the topic growth and development of fetus, intrauterine life. Please write down. I will wait and then I will mark that portion. Okay, let us mark the portion. Growth is defined as the measure of physical maturity. How much is the height has been increased, how much weight has been increased. So development, height and weight. Development is defined as a measure of functional maturity. So there are two terms. One is a growth and second is a development. Please write down. First is a growth. Please write down. Growth, physical. Growth, physical. Development, functional maturity. Functional maturity. That is speech, intelligence, memory, etc. In Ayurveda, growth and development are having the specific term. Growth is called as a vriddhi. I will wait, write down. Growth is equal to vriddhi. And development is equal to vikasa. Structural development and functional development. Two things: growth, structure; development, function. Ayurvedic words: growth, vriddhi; development, vikas. Okay, let us start. The main factors for growth and development, which are the things responsible? Here it is. First, proper nutrition, then individual nature of that particular child, then the time factor. Factors which influence growth and development are: there may be genetic factors from coming from the father and mother, genetic chromosomes. Then nutritional, how the baby has been fed by the after birth and also before birth. This primary discussion is concerned with both pre-delivery and post-delivery development. Okay, both. So nutritional factors. Then socio-economical. How much is the money with the parents? How they are feeding to the child? How the mother is taking the food? I am telling you, all this discussion can be considered as a before delivery in the uterus and after delivery, the development of the baby. For both, you can consider these factors. Are you getting my point? Okay. Environmental factors. Which is the month, that 9 month? Is it a Grishma Rutu, hot season, or is it a winter season? Naturally, you know, when the development is in the winter season, the child will be more healthier. If the development in the Grishma Rutu, little bit weak may be there. So then chronic diseases to the mother, to the parents, to the child, prenatal and intrauterine. These factors are more concerned with the development of the baby after birth. So don't get confused. So previously, sir, you are telling intrauterine, now you are telling post-delivery. Yes, that's what I am telling. We will discuss today both. Intrauterine also about the fetus, and we will also discuss about the baby. But for the intrauterine, I have the paper, but for the after delivery, I will tell you verbally, audio. Okay. Chronic diseases, then the prenatal and the intrauterine life, then emotional things and the hormonal things. All these factors will influence the growth and development. Now, month-wise development of the fetus. Formation of the nervous system, first month. Spinal cord formation and fusion at the midpoint. Then head folds forward and becomes prominent. Arms and legs become bird-like structures. Fetal hearts begin to form. Not fully developed. Begin to form first month. Digestive tract exhibits as a single tube. Is not fully stomach, small intestine, large intestine. No. In the beginning, there are only what you can symbolic. This bird, and then it will become flower, blooming of the flower. So the words are, it's a just beginning. Formation of nervous system, spinal cord formation and fusion at the midpoint. Head folds forward and becomes prominent. Arms and legs become, here, can you see the word bird-like? Fetal heart begins to form. Digestive tract exhibits a single tube. Length, total length of the fetus. Fetus means intrauterine. 0.75 to 1 centimeter only. Only, can you see? 1 centimeter. This much. Okay, 1 centimeter. First month. And weight in milligram, not in the kg. Can you see weight? This you can write down. Length 1 centimeter only. Only 1 centimeter, and weight only 400 milligram. First month after the pregnancy has been detected. Let us move further. What will happen next? All these things will grow up slowly. In the second month, can you see? The mainly concentrate on the length and weight, length and weight. Vital organs form in the 8th week. 4-week, first month. 8-week, 2 months. Simple. Rhythmic beating of the heart. Rhythmic beating of the heart. Arms and legs are more developed. External genitalia are present, but sex is not clear. Sex is not clear, whether a male or whether female. Nowadays, sonography is telling no determination, not telling to the patient, parents, no, nothing, no disclosure. We have seen that act, law, you know, that act says that you are not allowed to tell the gender of the baby to the parents. No disclosure. Okay. Placenta develops fully. This is most important. In the second month, full placenta development is there. Length only 2.5 centimeter. Weight is now 20 gram. Milligram is converted now, is a 20 gram. Here only 400 milligram. You know, the 100 milligram is equal to 1 gram, and then gram, and slowly, steadily it will go further. Now the third month. Fetal development. Kidneys are able to function. Urine formation, kidneys. Birds of the milk teeth are formed. Beginning of the bone ossification. Nail beds formation of the fingers and toes. Sex is distinguishable by outward appearance. Outward appearance, naturally. Length 7 to 8 centimeter and weight is 45 gram. 45 gram. Okay. Now we will go further. 4th month. Birds of permanent teeth. Birds, I am saying birds, not there are not teeth in the mouth. No, no. Only birds. Point, nucleus. Liver and pancreas start functioning. Sex can be determined by ultrasonography, but FTND Act, it is not allowing that. You should not tell the parents or anybody. Doctor should not write it down. This is male, this is female. No, not allowed. Length 10 to 17 centimeter and weight is 55 to 120 grams. I think as a homework, can I request you that you can make a table? Best way, table. For example, 1st month, 2nd month, 3rd month, or here you can write down, but better way, on the 1st, 2nd, 3rd, 4th, every student is requested to make that table, take the photograph and send it to me. The most important points in the beginning you write down. First point will be length on this side. Write down the length, 1st month, 2nd month, 3rd, up to the 10th month, length. Then 2nd point you write down weight. 2nd point weight. And then slowly, steadily you write down some organs or system. For example, nervous system 1st month. For example, here, have you seen that previous one? Here you can see kidney. So kidney, then nail beds. So this you can say which month it is appearing. Make a tick mark. Then sex is distinguishable in the 4th month. Okay. Now we will go further. This is the 5th month. Definite sleeping pattern and activities. Fetal movements are felt. This is most important point in the 5th month. Kicking, kicking. The baby is kicking to the mother's abdomen. So this very important. Fetal movements are felt by the mother in the 5th month. These questions, of course, you don't have any MCQ, multiple choice question. But if some student is doing the post-graduation, then this question will be definitely asked. Fetal movements following month, 2nd, 3rd, 4th, 5th. So you have to write down 5th month. Then lanugo covers the entire body. It's like covering. LANUGO. This word is very important. Please write down immediately. Lanugo. LANUGO. It's like a small sticky covering to the whole body. Lanugo. Then heart sounds are perceptible by auscultation. Please write down FHS. FHS. Write down FHS. Fetal heart sounds 5th month. Then movements of the fetus 5th month. So heart sounds, movements, they can be determined in the 5th month. Length is 25 centimeter and weight is gradually increasing to 20 grams. Okay. Now the 6th month. What is in the 6th month? Skin appears wrinkled in the uterus, baby. Eyebrow and eyelashes. This is eyebrow and eyelashes are well formed. 6th month. Vernix caseosa, again covering. Vernix caseosa appears. These typical words you must write down. Here, lanugo. Then vernix caseosa. 6th month. Hearing can be demonstrated by response of the sudden sound. If out externally there is some boom, then the baby will be having some response. That is, hearing can be demonstrated by response to the sudden sound. Length 35 centimeter and weight will be 680 gram. At least remember one number. If you don't remember the range, at least remember 25 centimeter, 35 centimeter, increase by 10. Then 680 grams, increase by 500 grams. Okay. Now the 7th month. Maturation of lung alveoli. Typical organ development, you write down in the month. 7th month, maturation of lung alveoli. Scrotal sacs, where the testis is there, and lower abdominal cavities are well formed. Blood vessels of the retina are thin. Skin is reddish. Eyes open and close. blinking, open and close. Length 38 centimeter, weight 1200 gram. So this is the 7th month. If even the child takes the what you can say the birth at the 7th month, no problem. We can keep it in that specific what you can say the arrangement in the intensive fetal intensive care unit, baby intensive care unit, and you can save the child. So delivery in the 7th month is not a big problem. Of course, it is a premature delivery, preterm baby. It is called as a preterm baby. If the delivery takes place in the 7th month, preterm baby. So baby weight is not enough to survive externally. So it has to be kept in the some photosensitive box. The special care has to be taken of that 7th month baby. Okay, but it can survive if the care is taken very properly. Next is the 8th month. Next is the 8th month. Birth position is assumed. Typical position, head should come down. Head should come down. Typical position that will acquire. Fetus is viable. If the delivery takes place, the fetus can alive. Then nails extend to the tip of the fingers. Eyelids are open. Subcutaneous fat deposition. This is very important so that the baby has a tolerance to the cold. So most probably this baby may not be kept for a longer time in that photo box or the light box. But here subcutaneous fat deposition is there. So whenever fat is there, it can definitely protect from the cold, a lot of cold, because the fear is of cold. If the premature in the 7th month, there is always fear of the cold and cold exposure. Length, here you can see at the 543 centimeter. Then weight 1600 to 2500 gram. Now the 9th month, full term baby. 9th month is a full term baby. Face and body have loose wrinkled appearance. Amniotic fluid decreases because no necessary now. It is taking birth. So amniotic fluid is not necessary. Lanugo disappears. First lanugo covering was disappearing. Fetus turns to vertex position. This is most important. Vertex. Head is down. Sole of the foot has 1 to 2 lines. Creases. Length 48 centimeter and weight. You remember both these figures very correctly because this is full term baby. 10th is over mature. So 42 to 48 centimeter and 1800 to 2700 gram. Approximately 2.5 kg. 2.5 kg. Okay. Now the 10th month. Vernix caseosa is fully formed. Skin is smooth. Length is 52 centimeter and weight is 3 to 5 kg. This is something not correct. 9 months and 9 days. This is the proper time of getting delivery. Okay. I think this is the limited notes that I have prepared for this lecture, but our class will continue with some audio clips. So just hear carefully what I am saying. Garbha Vruddhi Vikasa Krama. Please write down. Garbha Vruddhi Vikasa Krama. This is the important topic in the examination. The question is asked. Describe. Please write down. Describe Garbha Vruddhi Vikasa Krama. Garbha Vruddhi. I am saying repeatedly because I am expecting the students are writing with my dictation. It's like a dictation. Garbha Vruddhi Vikasa Krama. Okay. So what is Garbha? It's a revision, an addition to this lecture. What is Garbha? Write down. What is Garbha? What is Garbha? Charak Sharir Sthan. Please write down. Charak Sharir Sthan. Shukra Shonita Jiva Sanyoge. Shukra Shonita Jiva Sanyoge tu Khalu. Kukshigate in the uterus. Garbha Saudnya Bhavati. Shukra Shonita Sanyog. What is the Shukra Shonit? Spermatozoa and ovum when they are united. Okay. And when Jiva Sanyoga, Atma Pravesh, Atma is there according to Ayurveda. Not only male and female gamete, but Atma will be there. Then only it is called as a Garbha. Next question, oral. Write down. Garbha Vruddhikara Bhav. Please write down. Garbha Vruddhikara Bhav. There are 6. First, write down the number 6. First point. Matruj, from maternal side. Matruj. Number and name. Matruj. Number 2. Pitruj. Pitruj, from father. Pitruj. Number 2. Number 3. From the previous birth. Atmaj. Atmaj Bhav. Fourth. Satmyaj. Satmyaj, adaptable. Satmyaj. Then 5th. I think this is, the Satmyaj was 5th. 1, 2, 3, 4. Satmyaj was 4th. Sorry. 5th, Rasaj, from Rasadhatu. Rasaj. And next, 6th, Satvaj, mind. Sattva Guna, Satvaj. So this is called as a Garbha Vruddhikara Bhava. Matruj, Pitruj, Atmaj. 4th, Satmyaj. 5th, Rasaj. And 6th, Satvaj. Now don't write. Just listen. What are the Matruja Bhav? Some examples of the organ. Twak, skin. And Lohit, blood. So skin and blood is from the mother. Of course, there are so many, but I am telling you some few examples. So skin and blood. Twak and Shonit, Matruja. Pitruja should be strong. Pitruja, father. Asthi and Dantaja. Only 2 examples. Pitruja, Asthi, strong, and Danta. Then, 3rd, 2 examples. Atmaja Bhav, intellect. Buddhi, and Manas, mind. So our mind and intellect is depend on Atma. Okay. Next, 4th, Satmyaj, Indriya Prasad, best activities of sensory and motor organs. You know the sensory organs? Jnanendriya, Shrotra, Tvak, Chakshu, Prasana, Grahana. Shrotra, Tvak, Chakshu, Rasana, Grahana. 5 Jnanendriya, 5 Jnanendriyas. What are the Karmendriyas? Vak, speech, Vak. Pani, hands, Pani. Pada, legs. Payu, penis. I'm sorry. Payu, anus, anal opening. Payu. Upastha, Jananendriya. So these are the Karmendriyas. Sensory organ, motor organs. Ayurveda say Ubhayendriya. Ubhayendriya is a man. So all these sensory, motor and man, everything will be having good quality. That is called as a Indriya Prasad. That is Satmija. And general health, Arogya, is also depend on Satmeja Bhav. Now Rasaja, Sharira Vruddhi, development of height and weight. Rasaja, Sharira Vruddhi. Utsah, energy, depends on Rasaja. Then Sattva Guna, Sattvaja. What is depend on Sattvaja? Shanti. Om Shanti. Sattvaja Bhav. Shanti. And second, Shaucha, cleanliness, hygiene, ethical. Shaucha. So I have discussed what is Garbha. I have told you what is Garbha Vruddhikara Bhava. Now I am telling you, please write down the title. We already have video, Masanumasika Garbha Vruddhi. आयुर्वेद मासानुमास गर्भवृद्धि, आयुर्वेद मासानुमास month wise development of fetus, Ayurveda. This we have discussed allopathy today. Can you see here on the screen? That is totally modern science, modern pediatrics. Now I am telling you Ayurvedic. That is already been told previously. You can refer my previous videos. Okay, first month, that whole structure is called as Kalala. Please write down. Kalala. 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 First month Kalala. That is a sort of mass, only mass, MASS, mass. एक आम्ही मराठीत त्याला गोळा म्हणतो, गोळा, कलल. Okay? Then second month, please write down. Second month, that has having some shape to that mass. First only kalala, then there is a differentiation. Please write down. Second month, if that shape of that mass is oval, shape is oval, I am telling you how the oval, like egg, oval shape, that can be male, MALE, male. वो पुरुष हो सकता है, उसका जेंडर पुरुष मेल हो सकता है. Then if that shape is elongated, like pipe, elongated, that indicate female, gender. But we are not telling to the parents, we are not allowed to disclose. But I am telling you the text, what is Charaka Sharir Sthan, write down Charaka Sharir Sthan. And if shape is round, circle, only circle, then that is hermaphrodite, napunsaka, hermaphrodite. Okay? Third month, write down slowly and steadily. Ayurvedic, masanumasic vruddhi, third month. All sensory and motor organs simultaneously appear. Please write down. All sensory and motor organs simultaneously appear. Tritiye masi sarvendriyani sarv avayavani abhinivarthante. Charak Sharir Sthan. Third month. Fourth month. Chaturthe mase sthiratvam apadyate garbha. Sthiratvam. Charak Sharir Sthan. Fourth month, fetus achieves stability. Okay? Fourth month. There is also development of the heart, shows that presence of Chetana Dhatu in Ayurveda. Please write down. Fourth month, Chetana Dhatu. Chetana is Atma. Fifth, Ayurvedic, we are talking about Masanumasi. Fifth month, muscle and blood. Ayurvedic. Growth starts. Panchame Mase. Sanskrit. Panchame Mase. Garbhasya. Don't write. Just here. Garbhasya. Mausam, muscles. Shonita. Upachayo. Bhavati. Adhik. Mannebhyo masebhyo. Comparatively, muscle and blood is developing more according to Charak Sharir Sthan. Don't forget this reference. Write down every time. Charak Sharir. Chasha. Sixth month. First shlok. Can you hear? Shashthe masi. Garbhasya. Saptami. Garbhasya. Bala. Varna. Upachaya. Bhavati. Three things. Bala, strength. Varna, color and complexion. Upachaya, nutrition. Bala, Varna, Upachaya. Sixth month. आयुर्वेदिक गर्भ की मासानुमासिक वृद्धि के बारे में डॉक्टर देशपांडे बता रहे हैं आपको. ध्यान पूर्वक आखिर तक देखिए वीडियो. देशपांडे ऐसे जोर से चिल्ला कर बोलते पढ़ाते हैं, तो ध्यान पूर्वक सुनिए, बहुत अच्छा लगेगा आपको बाद में. हाँ, सिक्स्थ मंथ. षष्ठे मासे गर्भस्य. bala, varna, upachaya bhavati adhik yuktaha mausebhya. Adhike yuktaha mausebhya. Sushrut is saying very interesting thing. Sushrut, 6th month, Sushrut. 6 dash Sushrut, write down 6 dash Sushrut. He says, Shashte buddhihi. Shashte buddhihi, Sushrut. In the 6th month, child becomes intelligent. Next, 7th. Saptame mase, Garbha. Sarvo bhavaihi apyate. Sarvo bhavaihi apyate. Charak Sharir Sthan. Sushruti is saying, first, Sanskrit is also, hearing is very nice. We feel very happy when we say some chant shlokas. Saptame sarvanga pratyang vibhaga pravyaktaha. Sushrut Sharir Sthan. Both Charak Sharir or Sushrut Sharir. Garbhaki masanumasi kruddhi. Okay, Ayurvedic. Development of all bhavas. For example, dhatu, maus, shonita, all. 8 months, you will be definitely asked in your examination in the oral. See my finger. So don't forget 8 months. Why? So why it is important? Yes, you write down. 8 Ayurvedic. 8 month is very important because this line I am saying 3 times. And very important line. 8th month Ayurveda. Are you ready? Asthiro ojaha. You have to write down. Asthiro ojaha. Ashtanga sangraha. Asthiroha ojaha. You know, oj is very, very important. No, very, very. It is the essence of all the dhatus. This is our immunity. You know this oj. Rasa, rakta, mans, med, asti, majja, shukra. And after shukra, oj. Superb immunity, according to Ayurveda. But here, Vagbhat is saying, asthire ojaha, unstable. So what is that unstable oja? I will tell you. First, don't forget, Ayurveda, Ashtammas, asthire oja, very important line for examination. You must write it down. That means, Ayurveda says that oja is sometimes in the body of the mother. And oja sometimes in the body of the fetus. Oh my God, OMG. Sometimes, for example, in the morning, it is with the mother. Oj. Ayurveda is saying, research has to be done. And sometimes it is in the fetus. In the afternoon, in the body of the oj, I am telling about oj. So that is asthira. Today with the mother, tomorrow with the fetus. This is the language of Ayurveda. I don't know, but it is the language of Ayurveda. Asthire bhavati ojaha. And what is the importance? Sir, what is its importance? Then it is saying, if the delivery takes place in the 8th month, I am saying Ayurveda, remember, then there is a chances that either mother or fetus may have in danger. For example, tomorrow is a Thursday. And on that Thursday, Oja is in the body of the mother. And tomorrow delivery takes place. So there is no Oj in the fetus. My God, the fetus may die. Oh. On the Friday, next day, by chance, if delivery occurs, not tomorrow, Friday, then the Oj is with the fetus in the fetal body. Every alternate day, exchange. So if Friday delivery takes, fetus with Oj, mother, no Oj. Mother can die or mother can get lot of problems. Are you understanding what I am saying? So that is called asthire oja and its practical implementation. Ashtamamas is very delicate for getting the delivery as per Ayurveda. But I think, this is my personal now comment, some researches have been made on this particular part. And now it is said, even if delivery takes place in the 8th month, no problem to the fetus, no problem to the mother. No, no. Then, sir, our samhitas are wrong? No. Samhitas, we cannot say samhitas are wrong. What I mean, at that time, there may be some problems of sophisticated techniques of delivery, sophisticated techniques of instruments. That's why there may be some incidences that some getting problem with the fetus, maybe some getting the problem with the mother sometimes. So that is because maybe previous time, in the olden days of Charak Sushrup, techniques may not be very competent. And so these findings they may have observed. I don't know. Nobody knows. Nobody knows. But I think this type of explanation, action with action, you will not get in the class. But now you can tell to your teacher how the Dr. Deshpande has explained Asthire Oja Ashtamamas. Okay. Then 9th and 10th month, 9th and 10th Charak, Ayurveda. Tasman ek divas kale api navame mausam apadyati. Prasava kale ityahu dashamam masa. Okay. During the 9th month, fetus becomes much mature and may get the birth normally. If the fetus is retained in the uterus more than 10th month, abnormal, no, not correct. Okay. So, my dear friends, we have also seen all these factors, the modern pediatrics, what they are talking about the fetal development. And now, so we have completed the topic, Garbha Vriddhi Vikasa Krama. Garbha Vriddhi Vikasa Krama. Okay. Now, I am talking to you after delivery. For that matter, when the child is developing, there are different growth factors by which the growth can take place. Sharira Vriddhi Kara Bhava, Dhatu Vriddhi Kara Bhava, and Bala Vriddhi Kara Bhava. In 3 words, 3 lines you write down. Sharira Vriddhi Kara Bhava. Sharir Vriddhi Kara Bhava, that is growth promoting factors. Dhatu Vriddhi Kara Bhava. Dhatu, nourishment promoting factors. And Bala Vriddhi Kara Bhava, that is strength promoting factors. Okay. In Ayurveda, it is explained that there are 3 types of Sharira Vriddhi Kara Bhava. Please write down 3 factors. Sharira Vriddhi Kara Bhava. Number one. Write down. I am dictating you. I am discussing. First, I have told you that Sharir Vriddhi Kara Bhava, Dhatu Vriddhi Kara Bhava, Bala Vriddhi Kara Bhava. Am I right? This you have written. Now again, I will wait. You give the title on your notebook. Sharira Vriddhi Kara Bhava. Sharira Vriddhi Kara Bhava. And below that, you write down 3 words only. 1, 2, 3. 1, 2, 3. First, Kala Yoga. Kala, time. Kala Yoga. Kala Yoga, dash, underline dash. You write down Visarga Kala. You know the Rutu? Everybody knows the Rutu. Adana Kala and Visarga Kala. So, Hemant Rutu, this December month, best. Write down Kala Yoga. In this month, child, anybody can develop his body. So Visarga Kala, Kala Yoga, number 1, Kala Yoga, Visarga Kala, December, Hemant Rutu. Number 2, on the next line, Swabhavaja. 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 That is, in English translation, natural process. Natural. For example, you give the example, intrauterine fetus is having gained weight in the last trimester, last 3 months, 7, 8, and 9, very, very fast growth. That is because of the nature, it's natural. And also some children, after getting the birth, having fast growth in the adolescent. After the age of 10th, 10 age, 10 years of age, 10, 11, 12, fast height and weight increasing. Fast, fast, fast. That is natural. Swabhavaja. And third, Aradhya. Little complicated. Aradhya. A-R-A, Aradhya. D-H-Y, Aradhya is equal to proper diet. Proper diet. What we have discussed, Sharir Vruddhikara Bhav. Okay. Now, Dhatu Vruddhikara Bhav. Please write down. Dhatu Vruddhikara Bhav. Proper food as per Dhatu requirement. Proper food as per Dhatu requirement. Sir, what does it mean? As per Dhatu requirement. Rasa Dhatu, for example. What it will need to proper nourishment? Rasa Dhatu is a liquid. So it will expect in our food that we should give the baby proper drinking beverages. Water, then Suvarna Samskarita Jala, then maybe milk, best food. So these are the liquids that will nourish the Rasa Dhatu. Rakta will need the Loha, iron. So if we give the green leafy vegetable soup, what will happen? Naturally, Rakta Dhatu will be well formed. So Dhatu Vruddhikara Bhava means proper food as per the Dhatu requirement. What is the third thing you have written? Sharir Vruddhikara, Dhatu Vruddhikara, and please see in the notebook. Bala Vruddhikara. How my strength will increase, child as well as the adult. There are 5 points I am dictating, 5 points. Bala Vruddhi, to increase the strength. Write down the numbers. 1, 2, 3, 4, 5. Quick. 1, 2, 3, 4, 5. Write down. Bala Vruddhikara, Bhava. Elements. First, Sanskrit and then translation. First point. I will say 3-4 times. Don't worry, be happy. Balavat Purushe, Balavat Purushe Deshe Janma. Yes, I know it sounds cool. Balavat Purusha Deshe Janma. Balavat Purusha Deshe Janma. That means wherever you are, what you can say, the birth, that your parents should be healthy, and also the geographical area. Especially you can see that whenever the child is taking birth in the Europe, cold atmosphere, cold, thanda, cool. These children are more having some strong immunity and some strong strength. If you compare the 1-year child, Indian child, and 1-year German child, you will find a little bit difference sometimes. Not always, but sometimes. So that is because of the geographical area. So that cold things gives the protection and good nourishment. So Balavata Purushe, Rina, Purish, no Purish. Purish is a stool. Purusha. Balavat Purusha Deshe Janma. Next. Balavat Kali. Balavat Kale Janma. At a thanda, cool. Balavat Kal, which is the Balavat best time in the whole year. This December. Hemant Rutu is the best season to gain the strength. Okay, so Balavat Kali. Next, third point. Bija Guna Sampatcha. I am telling you, don't worry. Bija, what is Bija? Bija Guna Sampat, best. Sampat. Bija Guna. Spermatozoa and ovum. Chromosomes, genes should be strong. That is Bija. Bija Guna Sampatcha. Next, fourth point. Kshetra. K-S-H-E-T-R-A. Kshetra Guna Sampat. Kshetra Guna Sampat. Kshetra is a uterus. Female reproductive system. female reproductive system, that is kshetra. Chaturunam dhruvam sannidhyam, rutu kshetra ambu bij. These things are necessary for fertility to get the child. Rutu, kshetra, ambu, bij. Rutu, kshetra, ambu, bij. Chaturtha bhav. 4 types of the factors to get the pregnancy, fertility. But you understand, bija kshetra, bija guna sampat, kshetra guna sampat. And last point, ahara guna sampat. Ahara guna, proper first class, freshly cooked and having good nourishment. That food, ahara means food. Your diet is perfect, then you will get the strength. I will repeat 5 points. Balavat purushe deshe janma, number 1. Balavat kale janma, number 3. Bija guna sampat, 4th. Kshetra guna sampat, and 5th. Ahara guna sampat. Okay? Happy? Next. Please write down. Title. At least write down the title. What to be. If we complete or not complete, that is the another part. But write down the title, which will be asked. Milestones. Big title. M-I-L-E. Milestones. Milestones. Very important topic. M-I-L-E. Milestone. This video is already there on YouTube on my channel, Ayurveda Academy. Please check that, because when I upload the video, there are some at the top in between, some link is coming. So click that and see that 3 videos additional complimentary gift. When you are seeing one video, in between there are some up tags are coming. So click that and see that milestone. I have always given that videos to you from the very last 15 days I am giving you. So see that video. Anyway, today we will revise milestones during the childhood. I am talking about milestones during the childhood. Okay. And only few things I will write. You will write down the 2 or 3 points, 4 points. Milestones. Number 1, gross motor development. Gross motor, M-O-T-O-R, development. First point, milestones. Number 2, fine motor development. Fine, F-I-N-E, motor development. Motor means, you know, the Ajna and Saudhnya Vahana, sensory and motor system. Sensory means carrying the signals to the brain, and motor means getting the orders from the brain. So first was gross motor, second point was a fine motor development. Third point, language development. And fourth point, social development. So these are the 4 points from milestones. Now, first point, write down gross motor development. I will give only 1 or 2 examples. Okay. Head and neck holding. Write down head and neck holding 3 months. After completing 3 months, the baby can hold his own like this, holding his own. You need not to give support. But before 3 months, you always give support over here. When you carry the child, always support the neck and the head before 3 months. After 3 months, okay. That baby is now holding of his own head. Okay. Next, please write down sitting without support. Sitting without support. Baby can sit 8 months. 8. Please write down 8. Okay. Next, walking without support. No, mother is not needed. He walking without support. Please write down 1 year, 1 month. 1 year, 1 month. Okay. Then climbing upstairs. 1 year, 6th month. 1 year, 6th month. Okay. Then riding tricycle. 3 saki, riding tricycle on the road. 3 years. And skipping skipping 5 years. I am talking milestones. First point, gross motor development finished. These much examples are sufficient. Next point, keep one line blank, write down. Number 2, fine motor development. Fine. Now skill is needed. For example, I am giving the child some pen and he is holding. That is called as a grasping the object. Fine. It needs a fine movement. Grasping the object 4 months. Grasping the object 4 months. Pen, pencil, whatever. Grasping the object 4 months. Okay. Next. Transferring object from one hand to another. Some ball is given. The child can take this, that. He can move that hand movement. That is 7th month. Right now, 7th month. Okay. Then holding the object with index and thumb, like pen again. Only 2 fingers, not all. Only these 2 fingers. Index and thumb, 1 year, 12 months. The baby can hold. So these 3 examples of just examples. There are a lot of things in the book. Forget. First, you remember these only things. Now, third point, language. Speaking. Baby is speaking. Milestones. Okay. So, laughing, giving smile, laughing. 4th month. I am sorry. Before that, you write down turning the head to the sound after 1 month. Say for baby. Look. That is after 1 month. He can move his eyes and looking here and there. That is 1 month. Then laughing 4 months. Then monosyllabus. De. Only one word. De. Only one syllabus. That is 6th month. Then bisyllabus. Baba. De, one syllabus. That is 4 months. Baba, 9th month. Write down 9th month. Okay. Then 2 words with meaning. 1 year. They. That is 2 words with meaning 1 year. Simple sentence 2 years. Mala te pahije. Ai mala de. Baba mala mammam. That is 2 years. This is language. Okay. Then social. 4th point, social. Okay. First is a social smile. If the relatives are coming to visit the child and he just mother is there, father, and he will laugh, smile, only smile, not big laugh, smile, like that. So it is happening in the 8th week. That is 2 months, 8 weeks, smiling. Next point, in the social context development, milestones. We are talking about milestones. Recognition to the mother. He can identify, she is my mother. That is 3 months. Recognizing the mother, 3 months. Okay. Then sometimes some stranger comes and baby starts crying because he is getting something. Oh, this is not a normal, usual person. So that is called as a stranger anxiety. Write down. The baby starts crying, looking towards the stranger person. Stranger anxiety, 6th month. Stranger anxiety, 6th month. Then saying bye-bye, say bye-bye, bye-bye kara, that is 9th month. He will say bye-bye, 9th month, bye-bye. Then copying the parents. Whatever the mother will do, the baby will repeat. That is copy of the parents. That is 1.5 6 months, 1 year and 6 months. Asking for the food, ai mala bhook lagi, mammam. That is asking for the food, 2 years. He will start getting his own knowledge. Then knowing the gender and name. Telling the name and gender. कोण आहे बाबा तुझं नाव काय सांग मीना. She will start telling. That is 3 years. Then next, going toilet alone. Very important. Going toilet alone, 4 years. Then dress and understanding total dressing by herself. That is 5 years. When the child go to the play group. I think in this last 1 hour, Dr. Deshpande has given a lot of knowledge regarding the Garbhavruddhi and also the Vikas Sakrama, Ayurvedic perspective, modern perspective. Lot of things we have discussed in this small lecture of 1 hour. So I am very much thankful for your patience hearing, and we will meet on the coming Sunday in the morning at 11:15, talking about the Swasthavritta, and in the afternoon we will talk about Charakuttarad. So thank you very much. I wish all the best and take care.